Dr. Tan Wu Meng.
Mr. Speaker, I declare that I'm a medical doctor in a public hospital. I will speak today on our pandemic defense and our national capabilities, our frontliners and our healthcare workers. In a crisis, we learn something about the world around us, and we learn something about ourselves too. And from the crisis of a generation, we need to learn the lessons of a generation, because the next pandemic may be disease X, more severe, more contagious, less forgiving. The fight against a pandemic doesn't begin when the virus lands on Singapore soil. It starts in the preparation, 10 years, 20 years ahead. And that is what we must do for the road ahead as well. So we must strengthen our national capabilities ahead of time across multiple sectors. First, our supply chains. Our supply chains are our lifeline, whether it is face masks, surgical gloves, personal protective equipment, PPE, whether it is oxygen supplies, ventilators, medications. These are the battle armor and ammunition that our healthcare frontliners use to protect and save Singaporean lives. These supplies need to be ready and they need to be uninterrupted, going beyond just-in-time delivery and moving towards preparing for just in case. We saw what happened in other parts of the world when the healthcare system and its supply chains broke down elsewhere and cost lives, livelihoods, and cost hope for many people in other countries. We cannot let that happen in Singapore. So can I ask the ministers, what are we doing to strengthen our supply chains internationally? What is MOH doing, working to work with MTI on this? Are we mapping our supply chains carefully, not just the superficial layer of suppliers, but the dependencies? Who supplies the suppliers? Are we identifying the acupressure points, the points whereby if the supply chain comes under stress, there's disproportionate impact? Are we searching for the shatter points, the vulnerable points in our supply chains, so that we can strengthen, defend, protect ourselves better in a crisis? Because you can have three suppliers providing a tender to supply eggs to Singapore. But if the eggs all come from the same upstream source, from the same basket upstream, it's still a concentration risk for us. And we need to learn from this. On our legal capabilities, in a crisis, our ability to assess the legal situation and the rule of law around the world, that is also how we protect ourselves. For certain essential goods which Singapore needs to survive in a crisis, can we look better at the legal process of procurement? How can we defend our interests better? I asked this 2 weeks ago during the MOH debate on the budget. I asked whether MOH is working together with the Ministry of Law and the Attorney General's chambers to study whether certain essential supplies required for our survival, whether such supplies once purchased, once the purchase is done, can these supplies be gazetted as sovereign state property at that moment, even if the items are still in a supplier's warehouse overseas? I'm sure there's international lawyers with experience in the ministry. Our agencies should be able to study this, and I encourage the ministry to look at this as well. On our vaccine capabilities, we saw firsthand how important vaccines are. Saving Singaporean lives, saving patients, changing what could have been a fatal outcome to a severe disease to a mild illness, and protecting fellow Singaporeans and people throughout our island. We saw how important those vaccines were. There's been talk of fill and finish production of COVID-19 vaccines. Fill and finish means filling the containers and vials with vaccine and then finishing the packaging and process for distribution. But we must ask ourselves, is this good enough, or can we aspire to more? If there needs to be a new vaccine against a new COVID variant or a new pandemic, does Singapore have the capability to research, develop, produce the vaccine onshore, either through our own companies or through international partners working with us based on Singapore's soil. I called for this 2 years ago during the debate on the 2021 budget. Can the ministry give an update? Because this capability would be good for Singaporeans, good for Singapore, and good for the region and the world. On our scientific capabilities, how might we get better at understanding new pandemics, better understanding to make better policy? For example, testing for COVID. What tests? How often? One key early decision was whether to go with ART or PCR tests, and in what situations. Whether a frequent ART test with instant results compared to a PCR test that's harder to do, which may need a healthcare facility and which can't be done as often as frequent ART tests at home. It's an important difference, a test which is less sensitive but done very often at high frequency, compared to a more sensitive test which can only be done one at a time, less frequently. The concept of frequent ART tests at home to supplement PCR tests in healthcare institutions, this was already being discussed in expert journals as early as September 2020, New England Journal of Medicine. Could Singapore, with hindsight, and hindsight's always 2020, could Singapore, with hindsight, have moved earlier on this? How could we have opened our assessments and minds more in advance? Or for that matter, studying how a new virus is transmitted. Is it by droplets or airborne? Is it something we can detect in the surfaces we touch or the air that we breathe? International organizations like the WHO play an important role. They advise countries on whether masks are needed and other such safety measures. But we must still develop our own capability in-house, in Singapore, to research and understand new diseases, test the evidence, draw our own conclusions as well. On pandemic surveillance, we need to get better at detecting new germs in the environment. Not just what we know, but what we don't know. And importantly, to learn about what we don't know, about what we don't yet know. One such technology is metagenomics. In October 2021, I asked the Ministry of Health on the use of metagenomics. You take samples from the environment, whether it is surfaces, sewage, and so on. You then sequence all the DNA, both what is known and unknown. And if the pattern of that metagenomic study, if the pattern of DNA in the environment in sewage changes at the same time as many people are falling ill, that could be an early indicator of a new pandemic. The minister in his 2021 reply mentioned technical challenges, such as the complex mix of germs in the environment, complex microbiome. But we should keep on exploring these new technologies. This kind of hard work on sewage, I don't think Speaker will allow me to use the Hokkien phrase. This kind of hard work on sewage research can help save Singaporean lives. This brings me to biomedical research capability. It's 20 years since Biopolis opened. Big investment, biomedical research. There were naysayers back then, but the investments created jobs, helped Singaporeans to build up skills and knowledge, so that when a new virus came, we could understand it faster, sequence the genome faster, develop our own tests and kits and equipment faster. Some R&D is about short-term commercial results. Safe, conventional. Everyone agrees it should be done. The market already thinks it should be done. But there can be market failure. We know this, especially when planning for what is over the horizon, beyond a 5-year plan, but looking at 10, 20 years into the future. We need to make sure that our R&D, our research projects, include a diversity of approaches, including research which might not bear fruit straight away, but which might be useful in 10 to 20 years' time. Research that can build skills or act as an insurance policy if we face new and unusual challenges in the future. We also need to strengthen Singapore's artificial intelligence, AI capability. AI is no longer a niche technology. It's everywhere today. It will change how we work, how we analyze data, even how we do research and shape public policy. 5 years ago, during the budget debate, 2018, I called for Singapore to make a big push towards AI, because for certain key capabilities and skills, it's not good enough to depend on the private sector or outsourcing. We want to build in-house capabilities suited for Singapore's needs and to build these skills in-house as well. In the 5 years since then, the world of AI has changed as well. We now have ChatGPT. GPT-4 has come out. It's moving very, very quickly. Computing power has increased with lower energy cost. So we must continue investing in AI to see how it can help us prepare for the next pandemic and strengthen our healthcare system. Sir, I want to talk about our frontliners and our healthcare workers. Our frontliners made many sacrifices during the pandemic. I remember a young healthcare worker, young mother, married to another healthcare worker. She'd just given birth, newborn baby born during the pandemic. But because of concerns about COVID transmission between the husband's healthcare workplace and the wife's healthcare workplace, the husband had to move out of the home right after his wife had given birth in order to keep her and her colleagues safe. It was a big sacrifice. There were nurses who were kicked out of their homes, evicted at short notice by employers who were consumed by fear about this new and unusual virus. And some frontliners were outsourced workers, worried about falling between the cracks because they weren't sure who would take responsibility for their care and support, because although they worked in a frontline role, their job contract was with an outsourced company and not the frontline organization. So we must learn from our people's stories, see through the eyes of our people, and prepare ourselves better to support our people through the next pandemic. I want to speak on outsourced workers in hospitals. Our hospital cleaners and healthcare attendants are part of the front line, together with our medical, nursing, allied health staff facing COVID together. Our hospital cleaners helped clean the COVID ward, the toilet of a COVID patient in the ward. Our healthcare amas, the uncles and aunties, the attendants, they helped transport COVID patient samples during the pandemic. They were part of the front line too. In years gone by, these brothers and sisters were hired directly by the public hospitals. Today, many are outsourced. Same job, same workplace, same COVID risk, different contract, now outsourced to a service provider. But sometimes outsourcing leads to unintended outcomes. Again, 2020 hindsight is always clearer. But looking back, in 2020, the then finance minister had stated in the budget debate roundup speech, and I quote, "The government will award public officers on the front line who are directly battling with the COVID-19 disease up to 1 additional month of special bonus. This will include many healthcare officers in MOH and the restructured hospitals." But as I pointed out in Parliament in February 2021, there were Clementi residents and brothers and sisters in the labor movement who found that some cleaners serving in restructured hospitals did not qualify for this bonus because their contracts were outsourced. In the era before outsourcing, these workers would have been direct hires and qualified for the bonuses and support which in-house staff receive. Later that year, in November 2021, and in reply to my January 2022 Parliament question and my March 2022 questions to MOH during the budget debate, the Minister for Health confirmed that the subsequent COVID-19 healthcare award for, quote, all staff of public healthcare institutions, unquote, would include frontline healthcare workers from outsourced service providers serving at public healthcare institutions. This was an important step forwards, but the deeper lessons from COVID-19 remain. In a pandemic, nobody is safe till everybody is safe. Migrant workers, outsourced workers, gig economy platform workers, informal workers. No one is safe till everyone is safe. Second, on the pandemic front line, same job, same workplace means same risk, even if the contract looks different and says the worker is outsourced. And importantly, every worker matters, including outsourced workers, because the COVID virus, a pandemic virus, doesn't ask to read the terms and conditions of your job contract before infecting you. And we need to learn from these lessons of COVID. As I highlighted during the MOH budget debate in 2021, the policy reasons for outsourcing hospital cleaners and hospital attendants is not a compelling policy reason. The demand for hospital cleaners and attendants is not seasonal. It doesn't fluctuate that much throughout the year. In a COVID world, better for the healthcare team to be all based within the same healthcare institution rather than moving between different hospitals, as may happen with an outsourced arrangement. Outsourced cleaners already receive protective gear from public hospitals, recognizing they're part of the same workplace. And it also sends a message when our cleaners and hospital attendants are in-house staff. It sends a message that you are part of the same team, you are shouldering the same risk as everyone else, you are one of us and we are together. We need to send that message. So I call upon the government to look seriously at this as part of the post-COVID review and the lessons from COVID for governments around the world, because it is part of how we think beyond pure efficiency just in time towards resilience just in case. Mr. Speaker, I said this before during the debate on MOH's budget and the Committee of Supply. With your permission, may I say once again, through you, thank you to our frontliners, our healthcare worker brothers and sisters, our public officers. Your courage, contributions, and sacrifice made the difference, got us through this, saved so many lives. In Mandarin, 万分感谢我们的前线人员、医护人员、公务人员，有了你们的牺牲、你们的贡献，我们才能终于重新开放，雨过天晴。In Malay, terima kasih kepada pegawai awam kita dan pekerja kesihatan dan pekerja barisan hadapan kita sebagai satu komuniti yang bergotong royong, satu komuniti yang bersatu padu, satu komuniti kawan-kawan dari berbilang bangsa, bahasa, dan agama. Kami dapat mengatasi pandemik COVID-19. And in Tamil, Ingal Maramatna Nandri. Our sincere thanks for all that you have done and all that you continue to do. In conclusion, Mr. Speaker, 7 years ago, in my maiden speech in this House, I spoke of the outside context problem when a society encounters a life or death existential crisis that it did not foresee. So we must continue exercising our imagination, having the imagination to see what challenges may come ahead from over the horizon. So we must imagine the unthinkable and prepare to confront the unexpected. Preparing not in fear, but with imagination, resolve, and togetherness, so that no matter what happens in a dangerous world for small countries, nothing and no one will ever knock Singapore down. I stand in support of the motion.